And welcome, ladies and gentlemen, to this very special program on the 4th of January. Well, that's right. It's 4 days already into this new year, and what have we gained? We're still here. We're still talking about the COVID-19, the pandemic, and the restrictions. Well, let's take a quick look at the Queensland weather. Well, 28 degrees at the moment, and partly cloudy, but there is a severe warning for later in the day as well. Watch out for scattered rain showers. The highs will be of 30 today. So they were up to date on Australian Indian Radio. Well, right now, let's take a look at what these restrictions are. What is Queensland up to at this point in time? Let's hear from our Premier.
Thankfully, for the last 2 years, Queensland has been spared much of this pandemic. But this is a highly infectious strain, and I want Queenslanders to think really carefully over the next month where they go, especially if they haven't had their booster. So the Chief Health Officer, and we listened to the Chief Health Officer's advice, has given us very strong information about what we need to do, and that is wearing our masks indoors. So please do that. If you are elderly and you haven't had your booster, please think seriously about where you are going. Limit the number of large gatherings that you would be attending, because during this time, and we know that we're going to looking at having a peak at the end of January, early February, we really want to minimise the impact that this pandemic is going to have on Queenslanders.
So what the Premier is trying to do there is minimise the peak which has been predicted towards the end of January and early February. So we are bracing because we have opened up the borders. We have let people come in. Of course, it was Christmas, so it had to be done. And right now, these are the consequences. And so what does it really mean here in Queensland if we look at, say, the numbers and what's available, what is allowed, what is not allowed, what can we do and what we can't do. Let's take a look at that report and see what's the situation right here in Queensland at this point in time, going by what our Premier has just said. So there is no limit on gatherings in public outdoor spaces. Gatherings at the private residence are limited to a maximum of 100 people. So 100 at a time. Queenslanders can travel anywhere within their state or outside of Queensland that is not a declared hotspot. So if it's a declared hotspot, it's a no-go zone. Special rules apply for aged care facilities, disability accommodation services, hospitals and correctional facilities. You must practice physical distancing as much as possible and wash your hands regularly with soap and water and use alcohol-based sanitizer. So these are some of the things we have been saying from the week ago. Avoid hugs, kisses and handshakes. Wherever possible, keep at least 1.5 meters away, 2 big steps, from people you don't live with, or a gathering means a group of people coming together for a non-essential activity, like a party or a celebration. There is no limit on the number of people that can gather in outdoor public spaces. Remember to practice physical distancing as much as you can. Restrictions for events such as an indoor wedding ceremony, or maybe these are the things that people are looking for. So indoor ceremonies, wedding ceremony, reception, funeral, religious services, civil service, cultural ceremony, non-denomination service, etc., outlined in the restrictions on the businesses, activities and undertaking direction. So the restrictions on gatherings do not apply to the following situations. So these are the ones where it does not apply. Facility or service operating in accordance with or not restricted under the restrictions on business activity or undertaking direction. So these are at an airport that is necessary for the normal business of the airport, on public transport and at public transport stations, stops and platforms, at a medical or health service facility that is necessary for the normal business of the facility, for emergency services and disaster management. And of course, at a residential aged care facilities or disability accommodation services that is necessary for the normal business of the facility or residence at a prison, corrective services facility, detention center, or other places of custody, at a court or a tribunal for the purposes of an investigation or action by law enforcement authorities, for the purposes of complying with or giving effect to exercise of the power of the function of a government. Any of the government agencies or entity under a law for the purpose of national security, at Parliament for the purposes of its normal operations, at a workplace that is necessary for normal operation of those premises, at a school, university, educational facilities or child care facility that is necessary for the normal business of the facility, at an indoor or outdoor where people transition through the place, for example, Queen Street Mall or the Central Station, where people have to pass through normally, where the gathering is specified as exempt by the Chief Health Officer in writing. So apart from those places that we have just mentioned before, all other places the rules apply. Now, even in these places where gatherings are allowed, you have to gather in those restrictive manner, meaning masks are mandatory, masks must be on, and if you're going to any venue which is like a food outlet or anything like that, at the point of entry you will need to show your vaccination certificate as well as the check-in. So the check-in plus the proof of vaccination, which is now available on your phone as well. So they were up to date on Australian Indian Radio this morning, so there's quite a lot. Well, while all this is happening, what is our Prime Minister saying? So, he resists the call to make rapid antigen tests free.
As soon as they hit the shelves, they're gone. Pharmacies can't keep up with the high demand for rapid antigen tests.
We're flying in roughly about 500,000 tests every day or two at the moment.
Chemist Warehouse has 500 stores nationally. Their supply lines have been challenged by changes in testing rules, logistics problems and public holidays.
It really was a perfect storm, what's happened in Australia in the last 7 days.
The federal government says if you need a test, you can get one.
If you're a close contact or you're symptomatic, then you go to the testing centres and rapid antigen tests will be being made available.
But free, widespread testing isn't part of the plan.
We just can't go around and make everything free. We have to live with this virus.
Free tests are available for health and aged care workers and for remote Indigenous communities. But for anyone else concerned about their health, it's a scramble.
For those people who can find one, of course, we have some price gouging going on and it being simply unaffordable for many people.
The ACCC will be monitoring the pricing of those rapid antigen tests to ensure that there is not price gouging.
National Cabinet meets on Wednesday and concessions to help pensioners and people with a disability buy rapid antigen tests is on the agenda, as is assistance for schools. But the Prime Minister has ruled out free tests for the broader population, concerned it would hurt pharmacies and other businesses selling the tests.
They can now go and stock their shelves with confidence that they won't be undercut by the government.
Chemist Warehouse says it would have no problem with any government providing free rapid antigen tests.
This is the health crisis we're going in. Us as a retailer want this thing over. As a retailer, I want life to get back to normal for all Australians because that's good for business.
States have more than 80 million rapid antigen tests ordered and pharmacies already have more on the way.
We will have pretty good stocks in all our stores by week's end, barring no transport issues.
Hope that the shortfall will be short-lived. Melissa.
The shortfall will be short-lived. We hope so as well. As we know, it's been reported that the whole policy of this has been a bundled stuff up.
The Prime Minister is resisting calls to make rapid antigen tests free for everyone. The home testing kits are proving hard to find and expensive as the PCR testing system is stretched by soaring COVID cases. But Scott Morrison says that not everything can be provided for free and governments shouldn't undercut the private sector. Well, we're now joined by Shadow Minister for Social Services and Indigenous Australians, Linda Burney, who joins us now from Sydney. Thank you so much for taking the time to speak with us. So Australia,
good morning, Felsia.
Good morning. Now, Australia is experiencing this shortage of rapid antigen testings. We're hearing charities pleading for kits to be donated to them. Their pleas are reportedly being ignored. We do have the government, however, planning to meet on Wednesday to work through some plans to make free screening tests available, particularly to vulnerable communities. Is that something you'd welcome?
A number of points there, Felsia. It is extremely difficult to get these tests. I tried to buy some 3 days ago, ended up paying $20. There is price gouging going on, which is, in my view, requiring an investigation. The second point is that in Australia, if people need health care, they should get it. I took a friend yesterday to get a PCR test and she had to hand over her Medicare card. So why is it so different for rapid antigen testing? If people need the test and they are required to have it, then they should be able to have it at an affordable price and they should be able to have access to it. I have never seen such a bungled policy stuff up in my life.
Linda Burney, the crux of the matter, of course, here is this shortage of rapid antigen test kits. Now, the roadmap that we had, the roadmap out of the pandemic, was a real focus on the level of vaccination and the national vaccination. Should the supply of these test kits have been part of that roadmap?
Well, of course they should have been part of the roadmap. I mean, the fact that there has been a policy change and in some jurisdictions you have to have the rapid antigen test if you're in isolation, and yet they are almost impossible to find and they are at wildly different prices. In my view, the Prime Minister has really messed this up in a major way. People are confused, people don't know what they're supposed to be doing, and the fact that, you know, I was in a chemist the other day, the fellow behind me was a pool maintenance man. He had to buy $200 worth of tests because he requires to have the test to go into people's homes. So there are some professions that require it. And there are many communities, like you said, Felsia, that are incredibly vulnerable, that have very little money, and they should have access to the rapid antigen test if they need it.
Linda Burney, some of the vulnerable communities you're talking about is, of course, the Indigenous communities that are in remote parts of Australia. The current discussion across the country right now, of course, is about boosters. Do we have enough in terms of supply? But is that a conversation that should be had within the Indigenous groups while vaccination rates remain relatively low, especially within WA and South Australia?
And also Queensland, Felsia, we know that in places like Palmer Island, around Townsville, the vaccination rates are, you know, lucky to be 50%. We do know that there is a 20% gap in the second vaccination rates in the Indigenous community. This is the third year of this pandemic, and you would have thought by now the government would have had its strategy right. Indigenous groups have been left behind in every single phase of this rollout, including what you're referring to now, and that's of course the booster shots. They are incredibly hard to get, and in many communities where the vaccination rates are 50%, the booster shot is off into the distance.
Yeah, on December 22nd, you tweeted, I've had an Aboriginal medical service contact me today because they're having difficulty getting access to COVID booster shots. What are they actually saying to you when they request for these booster shots or for extra vaccines? What's the reply that they're getting?
Well, the reply is rhetoric, quite frankly. When I made that tweet, that medical service that actually run out of booster shots, they didn't have any available, and yet COVID is rampant in that community. This is a common story across the nation.
And as per her, it's a common story across the nation. But of course, we look at what the Prime Minister said, that the tests are available, but he does not want to undercut the pharmacies and the private businesses. And of course, they are looking at the meeting that's going to be happening tomorrow. And yes, JP Soni is saying, just go to your GP. That would be a good place to start. Well, right now, of course, there have been a lot of criticism in the policies, once again, in light of Omicron. Here's that report.
The Omicron variant is a game changer in this pandemic, swamping many of the policies we have relied on to stay safe these past 2 years, such as testing and tracing, isolation and quarantine. The pressure is now on for governments to set out a new framework for living with COVID, both in terms of public health policy and in terms of dealing with the swathe of illness and uncertainty cutting through the economy. National Cabinet is now back to meeting once a week in the face of the renewed crisis. On Wednesday, it will consider questions of concessional access to rapid antigen tests and an update on vaccine supplies. But as we have just heard from the head of the AMA, there is intense criticism of how governments, particularly the New South Wales government, have been changing their COVID policies. For a long time, the ambition of public health policy was COVID zero, or something very close to it. It saw the nation dubbed Fortress Australia, or the Hermit Kingdom. That's meant for the past 2 years our international borders, and sometimes state borders, have been closed, whole cities and regions have been locked down, and we have relied on the so-called TTIQ regime: test, trace, isolate and quarantine. In recent months, though, the crucial test of the management of the virus has changed.
The goal here is not to have no cases. The goal here is to ensure that our public hospitals and our health systems are able to be able to cope with this virus so we can live with the virus.
When the Omicron strain of the virus first emerged overseas in November, the initial response by the federal government and National Cabinet was to try to keep it out of the country. Plans to open borders to migrants, including international students, were delayed.
And now Omicron is here.
There were only a handful of cases in Australia by the time National Cabinet met on November 30. But the states and the Commonwealth decided to press on with a formal shift from a policy of elimination to suppression, emboldened by high vaccination rates. The PM started talking up the future.
You know, we're going into 2022 looking through the front windscreen, not through the rear vision mirror.
Even without knowing just how fast Omicron spread, however, there were already questions about whether Australia was responding fast enough to accelerate the vaccination booster program. But by December 10, National Cabinet confirmed that the central architecture of our public health policy response to COVID of the past 2 years was starting to unravel. It decreed that the test, trace, isolate and quarantine measures, alongside public health measures such as mask wearing, remain key to ensuring cases remain within clinical capacity. But unity about these measures had already started to break down. The most aggressive easing took place under the new New South Wales Premier Dominic Perrottet, abandoning masks and QR codes among a range of other restrictions lifted with the aim of opening up the state. Perrottet told people to go out and spend, head to the pub, get back to normal. That living with COVID now was a matter of personal responsibility.
Go out and support your local businesses. You know they've been doing it tough.
He got powerful backing from the PM.
None of these restrictions belong in the lives of Australians. Australians don't like it. I don't like it. Australians kept their side of the deal. And it is now time for governments to keep theirs, to put Australians back in charge of their own lives.
It was not to last. On December 22, the top public health advisory body, the AHPPC, pointedly reaffirmed the importance of face masks. Significantly, it said masks should be mandated in all indoor settings, including retail, hospitality when not eating or drinking, and entertainment facilities.
Would you like to see all premiers, particularly the New South Wales Premier, make mask wearing mandatory?
Well, there'll be decisions that they take in each of their states and territories. We don't have to mandate people wearing sunscreen and wearing hats in summer.
If I don't put sunscreen on, you're not the one who gets sunburnt. That's the difference here.
The next day, New South Wales announced the reintroduction of mandates for masks and QR check-ins. By this stage...
And of course, we know that the masks are now mandatory right here in Queensland as well. So we can see from the reporting sometimes, as JP Sodhi is mentioning there, sometimes they could be a little bit one-sided, and the party politics does come in there as well. Well, right now, here we are presenting the news as it is. So right now, let's go to New South Wales, where the hospital rates are increasing.
Sydney oncologist Nicholas Wilkin gets an alert every time a new COVID case is admitted to his hospital. Dr. Wilkin managed a COVID ward in September at the peak of Sydney's Delta outbreak.
Delta was a deadly disease, whereas the impression we get with Omicron is the lungs aren't as crook.
He says this time around the challenges have shifted.
Although it feels like a different disease and it doesn't feel as deadly, if anything, it's probably more disruptive.
The state government says recent sampling shows a number of COVID patients are actually being admitted to hospital with other ailments, some testing positive once there.
They have to be treated as infectious as well as their admission reason, which makes it a very complicated case to manage.
The number of COVID patients in hospital is set to surpass the state's previous peak of 1,286 tomorrow. Yesterday, 4 more patients died. There are now more than 1,200 people in hospital with COVID, an increase of 138 from yesterday. Another 12 people are in intensive care, bringing the total to 95.
The description from our members in some of the EDs is that they're being smashed.
1 in 5 of yesterday's tests were COVID positive, with more than 20,700 new infections detected, even as testing rates dipped. This morning, people queued early at this clinic in Sydney's east, but by lunchtime it was closed. The opposition says no extra staff are filling the gaps.
So there we go. The system is under a lot of pressure as the Omicron variant proves to be very, very challenging.
The planes are back in the air, the kids are back at school, the restaurants are opening, and a big Christmas is coming for all of us. And here we are today with one of the highest vaccination rates in the world, and Australia can now open up. We can open up. This Christmas we're about to have is a gift Australians have given to themselves.
But despite an enviable vaccination rate, for hundreds of thousands of Australians, it hasn't worked out that way. They have started the new year in isolation, having contracted or come into close contact with the highly contagious strain of the coronavirus, Omicron. It may be a far less severe variant of the disease, but countless Australians have also had family gatherings disrupted and their travel plans thrown into chaos. The days of lockdowns may be over, but government getting out of our faces appeared to instead open the door to the mass spread of COVID-19 across the country, surpassing daily records, with many more positive cases likely not included in the official data. Tens of thousands of cases have been recorded in the past 24 hours. New South Wales accounted for most of them, with more than 20,000 cases reported today. While Victoria has more than 8,000, states that previously kept the virus largely at bay, such as Queensland and South Australia, are now recording thousands of cases as well. Despite high case numbers, the proportion of people being treated in intensive care has not followed the same trend so far. The Omicron variant of the coronavirus has shown how unpredictable this pandemic continues to be. In just 6 weeks, Omicron has gone from nothing to maybe as many as 1 million infections a week in Australia, if estimates about underdiagnosis are correct. Dr. Norman Swan reports.
What's become known as the Omicron variant was first detected in southern Africa back in November. Within 2 weeks, it had spread to the rest of the world.
It's a new year, but with cases soaring to new records, it
doesn't exactly feel like a fresh start.
The Omicron variant is causing skyrocketing rates of COVID-19 infections in countries around the world.
The UK, South Africa, France and Italy reported the highest daily cases of the entire pandemic.
A significant reason for the massive Omicron surge is that the variant has partially evaded past immunity. The parts of the immune system which protect us against severe disease are the T cells, which can attack infected tissue directly. And vaccine research in Southern California and many other places has found the news is good when it comes to T cell immunity against Omicron.
While the antibody response is much decreased at the level of neutralizing activity, the T cell response is conserved. This would mean that the virus would have an increased capacity to infect people. So the vaccine would not be as effective in preventing infection, but if the T cells are there, they still would be able to prevent severe disease and eliminate the infection.
Well, the message is quite clear that the virus is still here, and it just keeps changing forms, and the different variants that have been coming about. And when we're making predictions and speeches, you need to be careful. No one can predict the future because many times it comes back and bites you. If you just go over the top about all the things that are going to happen, which you have no control over, because no one knows what tomorrow might bring. So I need to be very careful, but politicians being politicians, they like to put their point forward as many times. Now, just as a final point that I'd like to make here today is we are going through this and we are all in this together. And hopefully, that should have been the approach, and that would have been a slightly different situation. But right now, as we know, that states have chosen to go their own way. The National Cabinet is meeting tomorrow. We'll see what they come up with, what the recommendations are. But as general public, the onus on us is to do the right thing as well. Exercise care, and of course follow those regulations. So that's in light of that, we know that many functions have been postponed because in health of in interest of public health. So good on the people who have done that, because you never know. Should something happen at those functions, who is to be blamed, and where will the fingers be pointed? But if you are using the system, as we know, the system is already under a lot of pressure. And if you don't have an emergency, please don't dial 000. Leave the line open for real emergencies.
With COVID cases on the rise and emergency services stretched, came a message about who should be calling 000.
People only need to be calling that number if you have a medical emergency. Having some COVID symptoms is not a medical emergency.
Ambulance emergency, what town or suburb?
It echoed pleas from ambulance services and health authorities around the country.
Ambulances must be prioritised for emergency medical care.
And if in fact it's a coronavirus matter, please phone the coronavirus hotline.
Paramedic and union delegate Tess Oxley estimates half the call-outs on her last shift were from worried COVID patients. Most didn't need to go to hospital.
I left them at home because they didn't require any further health care, but they did require to be assessed and to receive a little bit of reassurance.
She thinks there needs to be a national public health campaign to actually explain what COVID may feel like as it progresses and how to treat mild cases of the disease, especially for people still waiting on a test result who aren't yet connected with their local area health service.
We're not educating the public on these things, and we're not giving them the resources to look after themselves at home to know whether they need to call an ambulance or not.
Some doctors have taken matters into their own hands, developing their own how-to guides.
So I'll just show you how to use this device. You just switch it on.
Okay. While federal health and most states and territories do have their own helplines and advice, doctors say it could all be made clearer.
Varies depending on the state. We do have a fair bit of confusion and chaos at the moment.
Federal Health says anyone with concerns could also contact the National Coronavirus Helpline. Penny Timms, ABC.
And the confusion and chaos out there is genuine, and people do get very, very afraid. But please be careful that unless it's an emergency, don't call the 000. If you need to get a COVID testing done, you go get your testing done. Call the COVID hotline. Leave the ambulances for real emergencies. I, for one, have used that many times, and I know when the need is there, and if you can't get an ambulance to come and attend to you, it could be a life-changing matter. So, please do that. Well, right now it's time to get a message from our sponsors of the segment.
GlobeNet Realty. GlobeNet Realty has been the longest established, trusted and respected agency in its trade area. Washa Chandra, Director of GlobeNet Realty, provides honest and ethical service to her customers. If you are thinking of investing in Brisbane real estate market, or if you are seeking professional property management, then you should contact Usha Chandra today on landline 3865 4466 or mobile 0419 775 416. And for further updates, log on to our website www.globenetralty.com.au. GlobeNet Realty is your own local real estate agency. Situated at Shop 52281 Sandgate Road, Boondall. GlobeNet Realty. Real estate is our world.
And real estate is the world. Don't forget that from next week, we resume the weekly real estate update series with Usha Chandra of GlobeNet Realty. Well, right now we'll finish off today's segment with having a look at some of the functions and events taking place. Now, be mindful that some of these might not go ahead. Please log on to our website, follow us on the Facebook and other things to get the updates of the functions that are going ahead. Ladies and gentlemen, once again, thank you so much for joining in. So, the highlight for today is the restrictions here in Queensland. There are many functions which are being postponed, and the variant is still here. We are on the 4th day of January 2022, and many people would have been back to work from today. Welcome back. I can see the streets getting a little bit busier and a little bit more people out and about. Not to say that around here, all the cafes and everything down at the Howard Street wharfs, etc., have always been busy. If you try and get a spot in there, it's impossible. So, you need to pre-book. people are not traveling interstate, but they are spending locally, which was good to see. So with that, the message is that please be careful, be mindful of the health directives, be, take the onus is on you to take that care. Don't worry about what others are doing. Oh, that person hasn't got a mask on, that person's not doing this. What are you doing? So that's the main thing, If you have your mask and the other person hasn't got on, you're still protected. So you do the right thing, and the right thing will be done by you. Until tomorrow, it's goodbye from me.